Hey everyone, it's Jasmine from the Moorpark College Student Health Center, and it's time to get vaccinated. Science kind of has its own language, and so people throw out these scientific terms, and if we're unfamiliar with the language, some things can sound really scary or concerning. And unfortunately, sometimes people translate science into scientific fallacies, which can make people second guess things like the COVID-19 vaccines. So in this video, I want to talk specifically about mRNA vaccines and the concerns over nanolipids, or PEG, polyethylene glycol, in these vaccines. So for starters, what do some premixed salad dressings, seasonings, cosmetics, and even some baked goods have in common with Pfizer and Moderna's COVID-19 vaccine? Well, they all contain polyethylene glycol, or PEG, PEG. And in some media campaigns, PEG has become kind of this big bad wolf or scary unknown. But the truth is that PEG is something we can find in many everyday items. But before we talk more about PEG, I also want to talk about a spreading fear of nanolipids. So in another video that I shared on how the mRNA vaccines work, I talked about kind of the specifics of how the vaccine creates immunity. But in this one, I want to talk about mRNA and how it gets to the cell. So think of mRNA kind of like Tony Stark's an Iron Man before he has any superpowers from his suit or anything else, right? mRNA is pretty weak, it doesn't last very long, and it's not very effective. But when you give Tony Stark his superhero suit, he all of a sudden has these new powers, and mRNA needs a similar protective outfit, or something that can help it reach the cytoplasm and be taken up by immune cells. But cells also kind of have their own protected layer, or this lipid bilayer that controls what comes in and out of the cell. So in addition to a super cool suit, mRNA needs a transportation device, and that's what lipid nanoparticles do. They help transport mRNA into the cell and protect it so that it can be effective. And PEG is part of that process. It acts as a shield and a barrier, and it prevents clumping of ingredients and helps control the size of particles. So when thinking about PEG and nanolipids, think of them as a way to make the vaccine strong enough to get the job done. And I know that it can kind of seem like, okay, well, this is everything that it does, but what about some of these specific online concerns? And I want you to know that there's been several studies done in the last 5 years on the safety of lipid nanoparticles, and I'll attach some of those in the video description. And data continually indicates that lipid nanoparticles are safe and an effective way to encapsulate things like mRNA. And so when we think about debunking the specifics of some of these anti-vaccination claims, remember to think about the validity of the argument. When someone says this is largely experimental, keep in mind that we are way past the experimental phase. We have over 300 million doses of COVID-19 vaccines given in the United States alone, and the vaccines continue to be safe and effective. And going back to nanoparticles, if someone cites a failed study using lipid nanoparticles, first, check when it was done. A lot of scientific progress has been made in the last few years. And you also want to look if the vaccine, if it was based on a vaccine or if it was used for another reason. Because some people have cited failed gene therapy or cancer drug therapy studies, and these studies are not doing the same thing as the COVID-19 vaccine is doing. So it's an apples to oranges comparison. And if you're told about a study showing the percentage of people allergic to PEG, question the dose of exposure and delivery method, because PEG is a minimal ingredient in the COVID-19 vaccine, and CDC data indicates an extremely low severe allergic reaction rate. To add additional safeguard, individuals are asked to wait 15 minutes after vaccination if they don't have a history of allergic reactions, and 30 minutes if they do, so that they can receive treatment if they were to have a reaction. But keep in mind that overall, the rate of severe allergic reaction between Pfizer and Moderna's mRNA COVID-19 vaccines is around 0.00047%. And if you see a story on vaccines damaging your brain, and specifically nanoparticles entering your brain and causing problems, Know that this is not founded in any science, nor has it been seen in over 300 million doses given in the US of any COVID-19 vaccine. But in a study cited by Harvard, researchers are starting to discover that the virus, COVID-19, can actually cause brain damage. The report indicated that COVID-19 can cause brain damage in several ways. In some cases, studies showed that COVID-19 caused brain encephalitis or swelling, which can damage the brain. Other cases had brain hypoxia or lack of oxygen, which can be caused by clots from abnormal clotting factors from COVID-19 and also result in brain damage. Johns Hopkins reported that the virus may have the capacity to enter the brain and cause a severe and sudden infection, and this can cause nerve damage, which may be responsible for symptoms like a loss of taste or smell. So in summary, we don't have valid evidence that lipid nanoparticles or PEG in the vaccine is dangerous, but we do have evidence that in addition to the risk of death, COVID-19 can cause a variety of long-term side effects. Vaccinations have repeatedly been shown to be safe and effective, but if none of this has eased your mind, consider the Johnson & Johnson vaccine as a safe alternative for you if you feel that's a better fit. And stay tuned for another dose